Hi everyone, Dr. Hall here, and we're going to go through the posterior muscles of the thigh, or all of the structures actually in the posterior thigh. So I've started with my Halloween decoration skeleton, and I've already put in place this muscle here, which as you can see is enormous. So this muscle attaches to the ischial tuberosity, comes all the way down and attaches to the distal femur, and also has a broad attachment all along the femur here. This is the adductor because it will, when it shortens, it will adduct the hip. Magnus because it's enormous. So it's technically in large part a muscle of the medial thigh compartment, but it is visible in the posterior thigh. So we're going to kind of start with that. It's kind of the floor of our posterior thigh. The adductor magnus is interesting because there is a little opening here called the adductor hiatus. And a hiatus means like an exit or a break from something. And so it is through that adductor hiatus, I have some stabilizing Play-Doh down there, that the femoral artery and vein are going to move from the anterior compartment of the thigh, where they have been until now, into the popliteal fossa, or that hollow behind the knee. So once they come through the adductor hiatus, these are now the popliteal artery and vein. The popliteal artery will then later bifurcate into the anterior and posterior tibial arteries when we get down into the leg. So the other deep structure that we need to show is the sciatic nerve, which is this enormously broad nerve. It's about as thick as a watch strap, and it's coming from up in the gluteal region, and it courses down the posterior thigh, and then it's going to bifurcate. So into two nerves. The one that continues down posteriorly in the leg is the tibial nerve, and the one that circles around laterally is the common fibular nerve. So we've got the sciatic nerve, tibial nerve, common fibular nerve. Now we can go ahead and add some of our muscles. So the first one is going to be the biceps femoris. So biceps, as you know from biceps brachii, means two heads. So this muscle has two heads. They both attach distally to the fibula. The short head attaches along the femur, and the long head comes all the way up here and attaches to the ischial tuberosity. Play-Doh is heavy. Okay, so there we go. So this muscle is going to do a few things for us. Obviously, it's one of the major flexors of the knee because as these muscle fibers shorten, they're arranged this way, it's going to pull the leg. So it is a major flexor of the knee, but because it also crosses the hip joint, it is also a bit of an extensor of the hip, causing all kinds of problems here. All right, so it will also assist with extension of the hip. Our final two muscles are the semimembranosus, which is this broader muscle underneath, and the semitendinosus, which is this very skinny muscle on top. Hence the name semitendinosus. Long section of it is so skinny, they're like, this muscle is practically half tendon, semitendinosus. So both of these muscles are going to attach on the proximal tibia. One, the semimembranosus a little bit more posteriorly and the semitendinosus more medially, and they also attach to the ischial tuberosity, which is a busy place, as you can see. So we have three main muscles in the posterior thigh, which are our flexors of the knee, flexors of the leg, because they flex the leg across that knee joint. We have the semimembranosus and the semitendinosus running over top of it. Biceps femoris here. And we can see the sciatic nerve coming down between them, bifurcating into the tibial nerve and the common fibular nerve. And then if we dissect these away, we can also quite easily see the adductor magnus muscle and our popliteal artery and vein. So that's the posterior thigh.